to put it the most simply, it's to extend the life of a person, to allow them the opportunity to change their life. They wouldn't have gotten that opportunity if they wouldn't have been revived.
From Diamond Pharmacy Services, this is PodcastRx. With our many previous discussions about opioid-related topics on this show, it was a given that Optics pharmacist Chris Bender would return to discuss the recent over-the-counter approval of Narcan nasal spray. Chris reviews how Narcan and Naloxone products work and explains why 4 mg Narcan nasal spray in particular was chosen for OTC status. We look at what this OTC designation means for costs and accessibility of Narcan, and explore what it could mean for destigmatizing Narcan use. And we have some fun at the end by talking about what additional medications we'd like to see get the over-the-counter treatment. I'm Adam Campbell, and welcome to PodcastRx. Okay. Chris Bender, always good to have you on the show. I say that all the time. You're probably tired of hearing it. But some really big news last month when the 4 mg Narcan nasal spray was FDA approved for over-the-counter use. This is the first ever Naloxone product to receive this designation. And given the opioid crisis we're living through, expanded access to a life-saving drug in this area is, of course, a very big deal.
Yeah, well, first, Adam, of course, I'm never tired of being back on the pod with you. It's always a great day whenever I can share some time with you. But you're absolutely right. I think this could and will be a huge deal. So yeah, thanks for having me on today to really talk about this timely topic and, help us to shed some light on this. I'm really looking forward to having our discussion today.
Yeah, absolutely. Me as well. We had a whole show just a little bit ago, a couple months ago, about the MAT Act making buprenorphine more accessible in the treatment space for opioids. And you shared your thoughts on that. And again, listeners, you can go back to episode 38, not that long ago. So to start, I'm curious, what was your immediate pharmacist reaction to this opioid adjacent news?
Yeah, well, obviously my first thought was, it's really about time. Narcan nasal spray was FDA approved back in 2015. And as you, our listeners, are well aware, since that time, the opioid epidemic really has only continued to worsen. So it only seemed appropriate to me to get this life-saving product into the hands of as many individuals as soon as possible. So I'm really hopeful that moving Narcan to OTC status can accomplish this. And then, my second thought was regarding cost. Typically, when prescription products move over the counter, the retail price drops quite a bit. So again, I'm hopeful that this price drop or this potential price drop could increase accessibility. But this may be offset somewhat by payment dynamics, which I believe we're going to be discussing or touching on a little bit later. Yeah,
we definitely will. And before we get into that, before we go any further, Chris, can you give me just a quick pharmacology recap of the available naloxone medications, Narcan, of course, in there, how it all works?
Yeah, sure. So naloxone, which is, of course, the active ingredient in Narcan, is an opioid antagonist, which means that it blocks the effects of opioids. So in the setting of an opioid overdose, you have all of this opioid binding to the opioid receptor, which is ultimately causing the respiratory depression as well as the sedation that you see. When you give naloxone, the naloxone actually competes for a spot at that receptor and displaces the opioid, effectively reversing the effects of the opioid and effectively reversing the overdose symptoms. So naloxone specifically is great because it can be given in so many ways. It can be given intranasally as a spray or via injection into the muscle, the skin, or even intravenously into a vein. Of course, the most popularized method has been the nasal spray, for which we have 2 ready-to-use products on the market. We have Narcan, which is 4 milligrams per dose, and Cloxado, which is 8 milligrams per dose. Now, before the advent of Narcan, the injectable naloxone formulation was actually able to be used intranasally as well, which was nice, but it required the attachment of a nasal atomizer device. So it was a bit less user-friendly than these newer ready-to-use nasal spray devices. With regard to currently available injectable products, there are generic naloxone vials as well as pre-filled syringes. There is also a higher dose pre-filled syringe under the brand name Zimhi or Zimhi. And then there also used to be an auto-injector on the market, which was sold under the brand name Evzio, but this was actually discontinued.
So with all of that, what you just explained, Chris, why is only the Narcan nasal spray in particular been given the over-the-counter designation? Why not anything else?
Yeah, and so the short answer to that is basically that Narcan nasal spray is the only product that currently meets the FDA's standards for what it considers to be appropriate for OTC approval. So in November 2022, the FDA released a statement, and in that statement, they listed, the types of naloxone products that they would consider to be appropriate for OTC approval. Now, included in that statement were nasal spray products up to 4 milligrams, as well as auto-injector products, either for intramuscular or subcutaneous use, up to 2 milligrams. So essentially, the FDA really only wants OTC products that have minimal risk for human error, which is why the generic injectable products are not included on this list. Now, additionally, they did go on to say that more data are needed on the safety and efficacy of any higher dose naloxone products, which is why the Kloxxado 8 milligram nasal spray is not yet considered appropriate for OTC approval.
And as I often do with topics that we touch on, Chris, I'm curious, how often are you fielding questions about Narcan naloxone in your everyday work with optics? We always like to tie it back to what we're doing here at Diamond. So what kind of questions are you typically fielding in this area?
Yeah, well, we get quite a bit of questions. It's a common discussion that we're having, actually. So we get a few different types of questions. Before Narcan nasal spray went generic, we'd often get questions about how to use the injectable solution intranasally, which I'd mentioned, was a thing that we were doing previously. And this was really because that was sort of a less costly maneuver. We also get questions regarding, like how many doses should be used, which, just as an FYI for our listener, there is no maximum amount of doses to use. And perhaps the most common question we get is regarding training. So a lot of questions from our nurses at our facilities. We're often asked if we have training devices as well as how to administer the product. The answer to this is typically that for training, we recommend that our facilities, our listeners, visit the Narcan website because they really have great resources for both healthcare professionals as well as the general public. In that they even include a kit where you can have access. They will send you training devices as well as educational pamphlets. So these are really good resources. And I believe we can put a link to both of those in the show notes.
We most definitely will. I had just a quick question about using the injectable solution intranasally. That requires the atomizer, you were saying. What's the difference between that and what the other, like the now OTC nasal spray device looks like?
Functionally speaking, they're the same. They achieve the same effect.
Okay.
The only difference is that when using the injectable formulation, you would have to make sure, first of all, that you had all of the pieces on hand, because when you open up the box of the injectable naloxone, it only has the syringe in the box.
Okay, right.
So you had to, what was often a concern of mine is that we would have a facility, say, order a bunch of the injectable solutions, but not any of the nasal atomizer devices. So they would be kind of left up the creek, so to speak, if they didn't have that. Now, with that being said, in order to do it, it was basically just like attaching a syringe to the or a needle to the tip of a syringe. But instead of a needle, it was this sort of foam, like almost like an earbud kind of thing, where you would screw it onto the top of the syringe, which would allow you then to push the plunger of the syringe and it would shoot out like a fine mist nasal spray. So it was effectively the same thing. It just required a few more steps, and it required staff to be aware that you needed to make sure you had both things on hand.
Right.
Which is why when having those discussions with facilities, it was always, a much more cost-effective option, but I always caution them that it is a little nicer, especially for an untrained individual, to simply pull this product out of a box, the Narcan product that is, and it's just ready to go the moment you open it, which is why, just in my own opinion, which is why I think that it gains so much more traction among the general population, because anywhere from a layperson to a trained healthcare professional could use it just the same.
Right. It's that out of the box capability, being able to look at the drug facts, the label, and it's very clear in what you need to do.
Yeah. And that actually, reminds me of something that was a big discussion when Narcan was being considered for over-the-counter use. The FDA was very cautious about approving it for over-the-counter use. They basically didn't want to do so until the manufacturer included very clear language on the products regarding how to use it. It needed to be very clear in plain English so that, almost anybody can pick this product up and understand the directions very simply. That's going to be a big thing moving forward.
Yeah, definitely. Chris, one of the off-cited concerns with this new Narcan OTC designation is that taking it from behind the pharmacy counter will actually make it less accessible. That is, it could be unaffordable. While pharmacies, of course, they've long made Narcan available without a prescription, the standing orders in each state, for instance, it was still billed through insurance, and now insurance usually doesn't cover over-the-counter medications. And though Narcan can now theoretically be sold at places like grocery, convenience stores, it could still be cost prohibitive for those needing it most. Do you have any ballpark guesses on what the retail price would be when over-the-counter Narcan finally hits the shelf?
Yeah. So unfortunately, the manufacturer of Narcan, Emergent Biosolutions, they haven't provided any pricing information or even when such information would become available. So, of course, keep in mind that this is a total guess. But forecasts, at least the forecasts that I've seen, are putting the cost somewhere between $35 to $65 per pack. Now, I'm not certain how the OTC product will be packaged, but I'm assuming it's going to contain 2 doses per pack like the current prescription product does. The concern here is that, as you so eloquently mentioned, this move will shift the cost burden from insurance to the consumer. Now, recent copay estimates have shown that those with private insurance were typically paying around $10 to $30 for a 2-pack of Narcan, while those with Medicaid or Medicare were actually paying even less, somewhere around $2 to $3 per 2-pack. So even if OTC Narcan hits the market with, say, like the lowest price estimate of $35 per pack, that's going to be a significant cost increase, particularly among those more vulnerable populations like the Medicare and the Medicaid populations. It's also important to note, along with this accessibility of moving over the counter, is that there are many harm reduction programs across the country that have been and still do provide Narcan and intramuscular naloxone for free through the mail. I know a good example for us locally here in Pennsylvania is Distro, which is actually an online platform that works to reduce drug overdose deaths and drug-related health issues. So I'm not sure how, if at all, the move of Narcan going over the counter is going to impact programs like these. But these could certainly help those who have difficulties obtaining the product moving forward. So for that reason, I will be sure to provide a link to Distro in the show notes as well.
Yeah, and I would imagine that these organizations, just because it's become an OTC thing, they're still going to be just as important for what you just Chris, said. You talked about you assume it's going to be 2 doses, like with the current packaging. For the prescription packaging, you're going to get 2 doses of Narcan. This is something I didn't know when looking into this topic, that many times it requires way more than just two containers to get the job done to reverse that overdose. Yeah,
and that's why I kind of make that assumption that it's going to still be 2 packs like the prescription product, because you see a lot more now in this synthetic opioid fentanyl driven era, that we are starting to see a lot more need for more than 2 doses. In fact, that was the entire selling point for the Cloxado 8 milligram product to come out to the market. Their thought process being, well, now you may only need to use one of our products as opposed to like 2 Narcan. So it really does depend on the clinical scenario, but we are seeing an uptick in terms of how many it requires.
Yeah. No matter how available Narcan is or isn't, I wanted to share this quote with you that I found from a recent article in Scientific American. It starts, quote, "We've given away naloxone like candy for the last several years, and the opioid death rates have continued to rise." This was a quote from Edward Boyer, medical toxicologist at the Ohio State University Wexner Medical Center. The article goes on to say after that Emergent Biosolutions says 44 million doses of Narcan have been distributed since 2016 when it first became available. But opioid overdose deaths, opioid overdose deaths have nearly doubled since then. Some 47,000 people died of such an overdose in 2017, compared with 80,000 in 2021, according to the National Institutes of Health. So given those still stark figures, Chris, what do you think are some additional measures that could be taken that could really maximize the impact of this OTC Narcan designation?
Right. So obviously more than just OTC status needs to be done. So, I think a media push would certainly help. And I think this will happen. Think just about how many pharmaceutical commercials you see on television every day. Thinking about that, if people could get exposure to Narcan and possibly even quick demonstrations via commercials, I think that could really help to raise awareness, break down the stigma, and even show people the ease with which it can be administered, because, I think this can be a barrier for some folks. And I also think that oftentimes people do want to do the right thing and do want to help, but people are often worried about getting in the way or causing harm. A lot of these media pushes and a lot of what I see from media organizations is we're driving home or trying to drive home the point that you cannot overdose someone on Naloxone. You cannot harm someone by giving them Naloxone. So err on the side of giving them Naloxone. So that's going to be a big point to drive across as well. It's important to realize that the people at risk of overdose are not usually going to be the ones purchasing this product. So friends, family, loved ones, or even just the general public. Like I said, they need to be aware and they need to be made to feel comfortable with using the product in the event that, they ever come across someone who may need the product. It's also important to remember here that Narcan isn't only for folks who may be abusing opioids, but it can also be used for just anyone who may inadvertently overdose on their prescription opioids. So many people may have a reason to keep this in their houses, whether it be, they know someone who may be using, but they may also have a grandmother who's on extended release opioids for chronic pain. So it really does impact us, even if we don't necessarily think that it does.
That's a great point.
Now, of course, this epidemic isn't going to be solved by making Narcan available OTC. Like, this won't be the only thing to end it. This has always and will continue to be or to continue to require a multifaceted approach. I know that you and I have recently discussed the expanded access to buprenorphine for opioid use disorder, which is obviously a huge step forward. But we also need expanded access to rehabilitation centers, as well as awareness brought to newer technologies that can help prevent overdose. This is just, as a quick aside, I kind of wanted to make a mention of this, that I think a lot of good progress has been made recently in this tech space. It's a kind of cool, actually. There are actually apps that are designed to help individuals use more safely. Such a couple examples that I was able to find include Brave and Canary. These are like phone applications. And there was also a recent FDA approval for the opioid halo, which is the first and only FDA approved device that an individual wears. And it actually can alert other individuals when signs of respiratory depression and potentially overdose are detected.
That all sounds like the things we should talk about in a future podcast.
Yeah,
it'd be its own.
Absolutely. There's a lot to discuss with those, and it's a fast moving area, which is pretty cool.
Right. You talked briefly about stigma of related to Narcan and the use of it. Do you think overall, though, just in general, that this OTC designation is going to do a lot to destigmatize it?
Yeah, for the general population, I think that seeing it sitting next on the shelf to some Tums or some Claritin will make it seem a little bit more normal. But perhaps the largest impact may be seen on those individuals with opioid use disorder. So as an OTC product, there may be less apprehension about going in and picking up a box for themselves. Whereas before, an individual had to see a provider, speak to a pharmacist, or even fill out, a bunch of information online to use one of the free online services. which if someone is using, they can feel, can often feel stigmatizing, and they may have actually led to fewer users actually trying to get Narcan for themselves.
Well, certainly can hope that goes a long way in just making it more routine.
Yeah.
And that people don't feel any kind of guilt for going and getting what they need.
Yes. And for purchasing a potentially life-saving medication.
Potentially life-saving.
And that's something too. It's important for, it's important for the end user to ultimately have access to it. But as I had mentioned in a previous question, a lot of times this is going to be in the pockets of the person not using illicit drugs. So,
of course,
as with many things in life, it does take a village. So that's why it's good for awareness groups advocate for everyone to have a dose of this on them at all times. So it certainly doesn't hurt to have it laying around.
Right. And the goal, of course, is to use a phrase that you've used in the past episodes when talking about opioid stuff, facilitate someone's party. That's not what this is about.
Exactly. And it's basically just to put it the most simply, it's to extend the life of a person, to allow them the opportunity to change their life.
Exactly.
And they wouldn't have gotten that opportunity if they wouldn't have been revived. So
exactly. Yeah. And it's something that you didn't have 10 years ago, and now you do. And it's interesting because, when you look at stigma too, social media can be an awful place to see stigma around like these types of products, because then it's like, well, why can't I just get my, why can't chemotherapy be so simple? Or somebody will draw a parallel, and it's like, well, that's not quite the same thing. And also, why would you not want to have a life-saving tool no matter how easy it is?
Exactly.
It's not, one doesn't have to come at the cost of another.
Yeah. And with OTC products, I think one of the general overarching themes from the FDA's perspective is we don't want this product to be harmful. And as I mentioned before, that's the great thing about Naloxone, is that it just does one thing. And it reverses opioids. It doesn't have any off-target effects. It's not gonna, it's not gonna have any like cardiac effects or anything crazy. It just fixes the overdose. So that's why it's great. It's like no risk, all reward.
Right. Well, to close out our discussion, Chris, listeners of the show know that you are an unabashed pharmacy nerd, self-proclaimed.
Yep.
So, with the delisting, if you will, of Narcan. What are some other prescription drugs that you would hope go OTC in the same fashion? And let's just take price out of the equation for now. Let's just keep it strictly pharmacological. I would say that what inspired me to ask this question, two things. Well, I have an infant daughter with a peanut allergy. So I thought, how great would it be that epinephrine auto-injectors could be purchased over the counter? So like a daycare provider could have one rather than having to always bring this prescription one. If there was an emergency and say she didn't have it, or other settings, somebody could just grab one, and one that's within date and all that, all things being considered. And also, like you said about Narcan, is that you can't give someone too much of it. It's the same thing with the epinephrine. I learned that it's not harmful to get a dose of it. It might quicken your pulse or whatever, but it's ultimately not going to harm you.
Yeah.
And so that's why I thought, that would be great. So with all that in mind, what are some other medications that you would think, this would be great if it went OTC?
Yeah, sure. It's certainly a cool thought experiment. So, the interesting, just to kind of give a little bit of background and sort of like a caveat about prescription to OTC switches, is that the FDA will only approve a switch when it determines that prescription status is, quote, not necessary for the protection of the public health by reason of the drug's toxicity or other potentiality for harmful effect, or the method of its use, or the collateral measures necessary for its use, and the drug is safe and effective for use in self-medication as directed in proposed labeling. So that's a lot. In other words, the ideal RX to OTC product is one that can be used safely by a person to treat their own conditions with minimal potential for harm. Because remember, we have to assume here that in many cases, individuals are going to be using these medications without consulting a healthcare provider, even though it always says it on the box. They made, a lot of times people just go and grab stuff and they use it indefinitely without any consult. So with that in mind, It's funny, when I was thinking about this, you can almost talk yourself out of any medication going over the counter because, when taken incorrectly, a lot of medications can have some degree of harm.
Sure.
I mean, that applies to most things in our lives. Think about stuff all the time, like caffeine, alcohol, even, acetaminophen, stuff like that, or Tylenol. Yeah. So that, that being said, there have been a lot of really good RX to OTC switches in the past. Allergy medications like Flonase, Nasacort, Zyrtec, Claritin, Allegra, acid reflux medications like Prilosec or Nexium, and then actually many others like Voltaren gel, Differin gel, Plan B. And another big one, this was recently within the past year, albeit not super pharmacy related, has been the availability of over-the-counter hearing aids, which, hopefully has the potential to expand access to many. So, ultimately to your question, I love the idea of an OTC epinephrine, particularly given the presence of severe allergies in our younger population. And plus, I know that often, and this is usually a good thing, but pens often go unused and expire, which I say is a good thing because that means we don't have to use them.
Exactly. Yeah.
And everyone is healthy, but it requires doctor's visits, for follow-up prescriptions. You have to call your doctor at a bare minimum. It's just a lot of logistics. So yes, the ability to walk into a pharmacy and grab an EpiPen would be fantastic. I guess the drawback here would be potentially, just to be devil's advocate, would be potentially like maybe fewer children seeing allergy specialists, and just how given the potential severity of those types of conditions, I'm not sure the overall population benefit would outweigh any potential harms due to, potential loss of routine follow-up. But there's a lot of medications, that could potentially be used. And there's many prescription products that I'd like to see become available over the counter. But again, like I said, all of which I could just as easily talk myself out of as well. The first is probably some form of birth control. Interestingly enough, actually, the FDA is going to be meeting in May to consider approving a progestin-only OTC birth control pill. This option is likely safer than a product that also contains estrogen, just because estrogen can have a risk of stroke and blood clot in certain patients. But progestin-only pills can be more difficult, given that they have to be taken at the same time of the day, every day, to ensure their effectiveness. That being said, I do still think it's a great step forward with regard to accessibility. There are others that I'd like to see that don't already have something in the works. So the more of a thought experiment on my part is I think a steroid/bronchodilator combo inhaler, something akin to Symbicort, would be great would be great for asthma patients. There actually already is a short-acting bronchodilator inhaler, which is available behind the pharmacy counter without a prescription. That's known as Primatene Mist. But a steroid-containing inhaler would probably be more appropriate for many patients to use as sort of a maintenance inhaler. And of course, the list could go on, but I think a couple other ideal OTC candidates would maybe be like or maybe like triptans, like Imitrex for acute migraine treatment, and even statins like Lipitor for cholesterol management. So I think it'll be interesting to see if we ever make any movement in the future on potential over-the-counter switches. But at the end of the day, it's really all about increasing accessibility while being able to do so safely. And I think from the provider's perspective, there's a little give and take. It certainly does help to lighten the workload if a patient is able to go out and grab some things on their own. But we also too worry that, what if we don't see that patient ever again? So sometimes can be a double-edged sword, but I'm hoping that moving forward, we do get a lot more cool options available.
Yes. And of course, amazing podcast fodder, all of it. Right?
Exactly. Every time.
Well, Chris, it's always a pleasure to talk to you. We'll keep watching this opioid space, because now we've had, like you said, buprenorphine access expanded. Now this with the Narcan. Yes. Who knows what's coming next?
And actually, too, that you just reminded me, there is actually in the works a 3 milligram Naloxone nasal spray product that is applying for OTC status as well. Okay. So we may have it even, more moving forward.
Absolutely. Well, we'll be here to talk about it for sure.
Sounds good.
All right. Well, thank you as always, Chris. And I know we'll be talking to you soon.
Sounds good. Looking forward to it. Take care.
This podcast features conversations with healthcare professionals. Their statements and opinions discussed herein are for informational purposes only. This podcast should not be considered professional medical advice and should not be used as a substitute for the advice of an appropriately qualified and licensed healthcare professional. Therefore, listeners must not rely on the statements made herein.
PodcastRx is a production of Diamond Pharmacy Services, the nation's largest correctional pharmacy provider. Catch our new episodes on Apple Podcasts, SoundCloud, Stitcher, Spotify, or wherever you listen to podcasts. Please rate the show and leave us a review. And if you have a topic you'd like to hear about on the show, or you'd like to share your thoughts on an episode, you can email us at podcastrx@diamondpharmacy.com.